Welcome, everybody, to our community conversation. It's good to be with you, even if it is virtually. You know, as I was preparing for today, I realized that it was just over 2 years ago that we canceled an in-person discussion of the mental health needs of our children. And to be honest, we thought, well, we'll just reschedule it for mid-April. Like, it'll just be a few weeks from now. Back then, we knew that low-income children in DC, who are, as you know, mostly Black and brown, were experiencing incredibly high levels of trauma and needed all of us, policymakers, advocates, and concerned members of the community, to act with urgency and to invest in new ways of meeting our children's needs. But little did we know that we would be pivoting to such questions as how to ensure that children who relied on free breakfast and lunch at school wouldn't go to bed hungry, how to ensure that that families wouldn't be evicted and overcrowd our homeless shelters at a time when being in the same room could be deadly, and how to get critical medication to children when it was too dangerous to take the bus to the pharmacy. Over the past 2 years, Children's Law Center has been working with families to keep children healthy, safe, and learning, despite the hardships and loss and isolation of the pandemic. We've relied on the generosity of so many donors and the partnerships of so many allies, and the advice of experts like Dr. Lee Beers and Dr. Christine Grady, who are with us today. As we move into the next phase of the pandemic, keeping children safe as medical and public health knowledge advances, but also helping children recover from the trauma of the past 2 years and building a safer, healthier, and more equitable future. I'm really delighted to bring them back together, the public health and ethics expertise of our two panelists. Together, we're going to explore the continuing impact of the pandemic on our children. Before I introduce them officially, I want to give you a little bit of housekeeping. We will have a conversation for a while, and then we will invite the audience to ask questions. And if you have a question, just type it into the Q&A function, into the chat function, actually, and we'll make sure to get to it. So now to our panelists. Dr. Christine Grady is the Chief of Bioethics at the National Institutes of Health Clinical Center and head of the Department Section on Human Subjects Research. Dr. Lee Beers is the immediate past president of the American Academy of Pediatrics. She is also a professor of pediatrics and the medical director for the Community Health and Advocacy at Children's National. And there's more. In this latter role, she oversees the Child Health Advocacy Institute's Community Mental Health Corps, and that includes such really important initiatives as the Early Childhood Innovation Network. Welcome back to both of you. Let's start our discussion with our very youngest children. So we all know that those under 5 for whom don't have a vaccine yet. And maybe we can start, Dr. Beers, with you. What do we know and what don't we know about when a vaccine might become available?
Yeah, absolutely. And thank you. And welcome to everyone. I actually see some of my Easton partners here on the call. So really, really happy to be here with everybody today. I think the first thing I actually want to say about vaccines for children under 5 is just really acknowledge the difficult position that families with children under 5 are in right now. It's very hard and it's very difficult. And I think many families of our youngest children really feel left behind. And so I just kind of want to acknowledge that and recognize that it is a difficult moment. What we know is, of course, just like every other phase in the vaccine development process with every other age group, there's a process, right? We need to see the results of the clinical trials. The results of the clinical trials need to go to the FDA and their advisory committee, and then to the CDC and their advisory committee. And so I think that's just as a little bit of backdrop of that's the same process. We're going to keep on with that same process, and because it's an important one, and it makes sure that any vaccines that are authorized are safe and effective. What we know and what we've been hearing is that actually both for two manufacturers, the two manufacturers who produce the mRNA vaccines, Moderna and Pfizer, that we are likely to actually see some data probably in May for this youngest age group. For Moderna, it will also encompass the 5 to 11-year-old age group. And then I think from there, we'll look at the, we're hearing promising things, but until the data is out and seen, we don't know for sure. So I think, we're hopeful that in May, May, we'll have a comprehensive data set that the FDA will be able to look at, that the public will be able to look at. We at the AAP will definitely also, our experts always take a look at it. And typically what we've seen from there is that then there's a couple more weeks to give our experts time to look at the data, go through those regulatory and advisory processes. And so fingers crossed, perhaps June. But I think, again, we're going to take it one step at a time. And in the meantime, do everything we can to help keep our little ones safe.
Dr. Grady, can you talk about any unique ethics issues? I mean, it feels like we got the first vaccine pretty quickly, and this just is taking a lot longer. Is that because of ethics issues, or what are some of the unique issues that come up?
Some of it is ethics, I think. I mean, I think, as Dr. Beer said, the goal of the trial, of any clinical trial, is to figure out whether things are safe and effective in the people, like the people in the trial. Ethically, research asks a small number of people to take on some risk and some burden in order to learn something that might help other people and might help the people in the trial too. And because of that, one of the important considerations in clinical trials is informed consent. People have the choice to decide or not whether to do that, whether to be in a study and help others. Well, children, legally and often cognitively or developmentally, cannot give informed consent. And so there are different, additional protections for children. And so the way clinical trials are normally done, if it's something that affects everybody, is adults first and then kids. And it's interesting in this, I mean, you said it's taken a long time, but when we think about how fast the vaccines were developed for adults, and I remember being involved in discussions, in the fall of 2020 about when is it right to start trials for children? Can we start with safety data only and not wait for efficacy data? And a lot of us thought that was a good idea because the impact on children is so huge. But then all of a sudden, the efficacy data in adults was there, and so the companies have started to, it did start then, to do trials in children. But the way they often do vaccine trials, usually do vaccine trials, is in an age de-escalation fashion. So starting with the oldest kids who are, more like young adults who have, at that point had already had data and more likely to be able to at least assent to what they're doing, and then work backwards. So, starting with kids over 12 and then 5 to 11 and then, younger. And so it's that process takes time. And as they're doing the trials in order to protect the children in the study, but also children for whom vaccines will be used, it's not only safety and, complex ways to look at efficacy because they're not doing the same kinds of field trials we did in adults, but also changes in dose and which is appropriate for the size of the child and the immune system of a child. So all of those things are complicated and take time. And so, we're hoping, as Dr. Beer said, for data that will support vaccines in the youngest kids.
That's great. So while we're waiting, and as we are, as public places are opening, and I think, offices, schools, restaurants, they're all beginning to open. Let's talk both about the public health and the ethical considerations when we make the decision either to exclude or not to exclude folks who are unvaccinated and folks who aren't masked. And I think perhaps we should take those separately. So perhaps we can talk about masks and how we think about that.
You want to go first, Dr. Beers?
I can go first. I talked a lot about this too, as you might imagine.
Yeah.
I think there's a couple different things to think about, right? I mean, and I think we've all been thinking a lot about this over the past couple of years, and even more so over the past year or so, I think. But there's a couple of considerations. As we need to think about how masks protect us as individuals, and how masks provide protection to those around us, and how they impact the potential spread of COVID to those around us. And so I think think, there are a number of things to weigh there. Again, as I mentioned before, I mean, I think our children under 5 aren't yet eligible for a vaccine. We know, I think, a lot about children who have special healthcare needs or adults who have special healthcare needs who may be more vulnerable. And so we do have to think a little bit about the balance of, an individual who may be at relatively low risk if they're vaccinated and relatively healthy and in a low risk age group, that wearing masks, they may be at lower risk for infection, but those around them may not be. And so kind of thinking about weighing that, I think the other thing that I think about, when I'm considering these calculations is sort of what's the burden of the intervention, right? Of whatever the intervention is. Burden is sort of a technical term, we use it as, but and I guess I can speak for myself. I think it's a relatively simple, straightforward intervention. And so with masks, I personally tend to err on the side of, if there are folks around me who need to be protected, I'm gonna wear those, and I would rather shift the burden or shift the calculus of of requirements, I guess, to keeping people safe. So.
And I know, Dr. Brady, you've talked about different settings and what.
Yeah. So I think, I want to just reiterate something that Dr. Beers already said. I think, ethically, we think about public health interventions like masks and even vaccines in a way to try to figure out how effective are they in protecting the public health, and what are the trade-offs, and is it the least restrictive way that we can have the positive effect. So those are the kinds of things that people consider from an ethical perspective. But important in this case, as was said, it's not just, we don't just wear masks for the public health, we wear them for ourselves as well. They help us too. So there's individual interests at stake and welfare at stake as well. I do think that, there are places where there are a lot of people, it makes more sense to both protect yourself and the people around you. And also, if you, as Dr. Beers already said, if you're living with people who are at higher risk, or if you're in a situation where there are people at higher risk, then of course that has an important consideration too. I actually think it's really, right now, really hard for children to figure out what to do about masks, because so many jurisdictions have lifted mask mandates in public places and even in schools. And, I was looking at this World Health Organization document on masks for children, and it starts with a sentence that says, decisions about mask use in children should be based on what's in the best interest of the child. And I thought, well, I agree with that, but how do you figure that out? Because in these cases, I think children are both, they have their parents telling them something, they have peer pressure, they are, every child is different in terms of their level of anxiety and worry about this. And I think it's a really hard time for children to know what to do about masks. I really do. And some are making some choices and some are making others. And we should be providing settings of, acceptance for whatever the choice is and flexibility for whatever the choice is.
Dr. Beers, can you give us advice about how to talk to our kids about this issue?
Yeah, no, definitely. And I think, as you know, I have 2 school-age children. So this is professional and personal for me in terms of thinking about this. And I think, I think there's a couple things when you're talking to your kids about this. I think one is, I think you've probably heard me say this, many times over and over and over, our kids do take our cues from us. And so if we approach mask wearing as, this is just kind of a part of one of the tools in the toolbox that we may need to use under certain circumstances to help keep ourselves safe and help keep others safe. And, it may not be the most comfortable thing in the world, or there may be something that's irritating about it to you, but we can kind of work through that and figure it out, because we do that with a lot of things, right? my kids, when they were very little, they screamed like crazy when you put them in the car seat. But you work through it and you figure it out, right? And so I think the more as adults we can think about it that way, because I think we will, we're gratefully at a lower point in the spread right now. We may get to a different point, and so these are going to be conversations we have to keep having. So I think that's one thing. I think the other piece is just really helping your kids think about, right? This is to help keep you safe. It's also to help keep those around you safe. And actually my experience has been that talking about it with my own kids, with kids in our community, and then actually talking about it with, my friends and colleagues in other places, that really resonates with children. Is they care about each other. They care about their community. They care about their friends. They care about their teachers, right? And so talking to them about mask wearing in the context of this is something we can kind of do for each other to help keep each other safe. I think that really resonates with them, and I think it helps. It also helps give them a sense of control over. This has been a crazy couple of years, and there are things that we can do that we have control over, and I think for our kids, that's one of those things.
I think I've heard you use the word kindness. That you talk to kids about kindness and taking it out of all the political realm and just the human interaction of being a kind person.
Yeah, absolutely.
That makes sense. So how about vaccines? That maybe is a bit more complicated. How do we think about excluding or not excluding folks who have been vaccinated or not been vaccinated?
So, maybe I can say something about this, because I think, Judith, you referred to different places. So I work in healthcare facilities, and I think that in a healthcare facility, a hospital, or a nursing home, or other places where there are people who are quite vulnerable and susceptible to risk, that vaccines are really important to protect those people. And those of us who work there have a responsibility to do everything we can to protect the people we're taking care of. So I find, requiring vaccines for healthcare workers actually has a lot of support. Now, it is also important to keep in mind what we just said. It's also good for the healthcare workers, for their own well-being. So it's like a double benefit, right? And so it seems like hard to argue that it's not a good thing. Now, by law, there are exemptions. There are medical exemptions. There are sometimes religious exemptions, and that makes sense because even though it seems like the right thing to do is to have as many people vaccinated as possible, there will be the need for some exceptions.
And how about in other settings other than hospitals?
Yeah, so I know other settings less. I think it's an interesting question about schools, for example. I know that there has been a lot of encouragement about, especially teachers, but also children getting vaccinated in schools. Again, there needs to be exceptions, and there maybe needs to be other mechanisms for enhancing safety for those who are not vaccinated, or for those who are near people who are not vaccinated. So I think that there are other things that need to be taken into account. But there's an interesting question in my mind, truthfully, in terms of the ethical responsibility to care for others. Teachers care for children, and so children are at some risk. They're not maybe as high risk as the teachers are, but they're at some risk. And so maybe there's a justification for real encouragement of teachers to be vaccinated. An ethical justification.
Judith, the other thing I would add, I agree, this is a super complex question, right? And there's a lot of things that intersect. And I think, whenever we're thinking and talking about this, you're weighing a lot of different things. And I think sometimes the thing that doesn't get as explicitly discussed is also, the right for individuals who may be more vulnerable to infection to be protected as well. And so certainly, right, there's been some, I think recently you may have even seen this, some legal action around children with disabilities, right? With children who have special health care needs, and what is their right to a free and appropriate education, and what does that mean in terms of safety from COVID? So I think this is a super complex question, but I do think it's also important that we're thinking about that piece of it as well. Like what is our responsibility to make sure that, in schools, for example, children who have special healthcare needs or who may be more vulnerable to negative impacts of COVID are able to access all the services that they are entitled to.
So this might be a really good time to ask, because it's obviously hard to talk about this without acknowledging the highly politicized nature of it, right? Like that factors into all of our thinking and how we go about it. So maybe it's a good moment to ask this question. The difference between public health recommendations and what I, as Judith Sandalo, might want to do on behalf of my granddaughter, or what you, Lee, might want to do on behalf of your kids or anybody else. So how do we listen to what the CDC and DC Health tells us and other experts and filter that for ourselves? And are they different or are they the same?
Well, I do think that there are good reasons to listen to the advice of public health experts, that they, give advice based on data, and data is useful in terms of making decisions. I also think that, to the extent that it makes sense for us, we should follow that advice. But there are circumstances that individuals find themselves in, which sometimes, create a situation where it doesn't make sense to follow the advice, or the advice needs to be tailored in a certain way for the specific circumstances. And I think that is perfectly acceptable and should be perfectly acceptable. And it's kind of like what I was saying before about the, kids trying to figure out whether or not to wear masks. I mean, for a while they were told they had to. That now they're being told in many places, it's up to you. And some cultures, some school cultures, I think, are like, there's no more masks, and others are like, we'll let some people wear them and let other people not. I think each child needs help to figure out what their particular circumstances are and what's best for them based on that kind of advice.
I would also just add, I think as human beings, we don't do great with uncertainty. Right. And we don't do great at sort of, we want an answer. I get it. Like we all do, right? We want an answer. We want the answer to be the same. We want to be able to sort of say, okay, it's this way. Now I need to do this. And I think one of the things that has been so very challenging over the past couple of years is that there is so much uncertainty and so much evolving knowledge. And that, I think, we get this cognitive fatigue about having to make these decisions, and that is then overlaid on some really highly politicized discussion and thinking, and so I think honestly also just to really acknowledge that and just acknowledge our own, every day we all make decisions about our risk for different things, and it's just are things that we've been making these decisions somewhat unconsciously for our whole lives. And so they don't feel as uncomfortable. These are new decisions for us, and in the context of a lot of uncertainty. And so I think, I also agree with Dr. Grady, there's good reasons to listen to our public health experts. These are people who have dedicated their lives and their careers to knowing and understanding all the nuances, and it can feel frustrating because there are a lot of nuances, but these are people who have really dedicated their lives and careers and have so much skill and expertise and experience that it's valuable advice.
That makes so much sense. So before we move,
one more thing about that is, not only the uncertainty, but the fast changing knowledge, I think has been given some people a little bit of maybe more difficulty in trusting advice because, it's changed, and it's changed because the pandemic has changed, and, and we know more, we know more, certainly more than we did you know, even a year ago, but certainly two years ago. So those things are hard in terms of understanding advice, but I 100% agree with what Lee just said.
Yeah, it does seem like we have an opportunity to teach our kids about science and how it's evolving and changing, and learning from mistakes, and also the changing nature of that. It seems like a wonderful opportunity for teachers to.
Absolutely.
Yeah. So before we turn from protecting ourselves from COVID to the impact of the pandemic more broadly, I do want to ask one question, which is the current state of knowledge about the risk of COVID on kids. I know early in the pandemic, we were focused on the impact on older people, but I think there's been more new data on the risk on kids. Can you kind of bring us up to date on what we know?
Yeah, absolutely. You know, and I think a couple things, you know, I would say the top line thing is that COVID can be a very serious illness in children. Most children are going to be fine. And so as an individual, that's important to remember when your child, you know, if your child is infected with COVID, most likely they're going to be fine, but COVID can be a serious illness in children. And so I think there's a couple things to think about. One is that I think we have very naturally, you know, we compare the impact on children in sort of raw numbers to the impact on adults in raw numbers. And I think it would be it's important for us to shift the way we think about that, because children generally are healthy, right? And so an illness that you know may, you know, when you compare this percent to this percent may seem less serious. When you look at it sort of proportionately to other illnesses and how they affect children, it is greater. And really, this is what we're trying to do, right? We're trying to keep kids to grow up healthy and safe and strong throughout adulthood. And so, you know, from that aspect, you know, when we look at COVID, you know, the numbers, the official numbers often typically lag by a couple of years, but when you sort of cross things on top of each other, I think, you know, there are estimates that COVID is you know, one of the top 10 causes of death for children over the past year. Puts it into some perspective of there's, you know, you feel like there's small absolute numbers compared to adults, but in the context of children's health, that's really significant. And so, but I also think you have to think about other things, you know, hospitalizations, you know, there've been a lot of kids hospitalized with COVID. And I think particularly we saw during the Omicron wave, where it just was so transmissible, and the absolute numbers of children who were infected was so much higher. That meant the number of children hospitalized became so much higher. And we did see a shift to increased hospitalizations in younger children as well. And so I think, you know, that's another important piece to remember. And I think the other thing is recognizing that there are other impacts of COVID. You know, kids do get long COVID. They get, you know, they have symptoms that can persist for months sometimes, or even longer. Kids do get, a small number of kids, but this is a serious illness, get this condition called MIS-C, which is the multi-inflammatory disorder that children can be incredibly sick with. And then there's also just the disruption to home and school. And, you know, you get COVID, you're out of school for 5 to 10 days. That's disruptive. It's disruptive to your activities. It's disruptive. So I think all those things together, you know, really remind us that you know, COVID can be a very serious illness in children, and it is worth us being thoughtful and mindful about protecting our kids from that as much as we can, weighing all the risks and benefits of everything, right? But it is, but there's good reason for us to be thoughtful and cautious.
So when you say that, I think all we hear is, oh my God, COVID, it's dangerous for my child. But I just want to pull back for all of us to say, of course, the risks, and we're about to talk about them, of learning remotely, of not having social contact, is also very harmful. So that it's not a risk that's out there by itself, right? We're balancing what you just described with all the other risks. And it's a perfect transition to, let's talk about that.
And actually, can I add one more thing, Judith?
Yes.
It is so important to remember, we have ways to reduce the risk. It is, this is not, we know this is, we've learned a lot over the past 2 years. We have ways to reduce the risk. And so just being thoughtful about, okay, nothing in life is zero risk. But what are the things we can do and implement? And, I can't resist the plug. Being vaccinated dramatically reduces your risk of serious illness, long COVID, hospitalization. And so that is one of the things that as an individual you can do for children who are eligible, age eligible. That's one of those things you can do. So I think it is a really important point, but it's also important to remember that this is all about balancing risks. And there are things we can do to reduce the risk so that we can make sure that our kids are really optimizing their ability to be able to participate in all those other things that are really important to them.
Right.
Makes perfect sense. Well, let's move from COVID to the pandemic. And obviously COVID itself caused a great deal of harm to kids as COVID, because I will say 40% of the children that we work with lost a loved one. So that's directly about COVID itself. But there's also the pandemic, which the pandemic and how we responded to keep ourselves safe from COVID meant that people lost jobs and children went to school remotely for 2 years. I mean, I think about fifth graders now in school were 8 years old when they were in school last time, and we're asking them to behave like 10-year-olds. So there's a lot going on. And so with that sort of as a preface, let's just jump into a few of those things. And we've got mental health as one big area, which I know has been a massive focus for us. Thoughts about the impact on kids broadly? And where do you want to start, Dr. Beers? Because there's so much to say.
I know, it's very well. And I'll say a little bit. I know, Dr. Grady, I'm sure you have stuff to add to, I think, so I'll start with mental health. And I think, I'll do my very best to be brief. I could talk for a very long time about this. But I think there's a couple of important points. First is that there, even prior to the pandemic, we were really in a pretty urgent state around mental health for kids. Rates of mental health concerns have been increasing over the past, 10 years in particular. The system of care for our children to access, well, our adults too, actually to be able to access good quality, accessible, culturally appropriate mental health treatment is very fragile. And so then when we layered on the additional stresses of the pandemic on top of that, it really broke the system, I think. And so, and what we're seeing, it is a complicated picture, actually. Some kids, it's a complicated picture. Overall, rates of mental health concerns have been worsening over the past 2 years for children and adolescents and families. There are some subgroups for whom that is more dramatic. Young women in particular has had a real toll. We've seen really significant increases in rates of eating disorders, and that very, very dramatically. And so I think, but there are also some kids who the sort of kind of jiggering of their lives actually ended up being protective. And so it is a little bit of a complicated picture on an individual level, but overall it has had a negative impact, and it certainly has had a negative impact on the mental health system of care because it has placed an enormous amount of stress on our mental health providers. It's placed an enormous financially, many of them have not been able to sustain their practices emotionally. It's been really hard to take care of so many sick kids for very long periods of time. And so I think, but it is also, and I would have to end by saying, it's also an enormous opportunity for us to take a step back and say, what are the things that weren't working? There are a lot of them, and how, and we're to get to the place where we need to be for our children and families, we really need to think transformatively. And so let's do that. Lots of things have been upended now. And so let's think let's think in a really transformational way about how we redesign the system of care for children and adolescents. And I also just have to, one last thing, have to really shout out, we really have to make sure that the children and families are involved involved in that decision making, and involved from the very beginning stages. Again, some of my I see some of my colleagues, Ms. Patterson and Ms. Avon, on the call, who are my colleagues in Easton, and they know I've learned this from them, and from all around us. It is really important to make sure that we have the family voice in these decisions, and this thinking and this strategy about how we move forward, when we're thinking about redesigning how we provide mental health services.
Yeah. Can I just emphasize one thing? I think the everything you said, I agree with. I just want to emphasize, the moment to try to do something about the resources. I mean, I think there was a New York Times article last Sunday, maybe, on this issue of mental health in children. And exactly as Dr. Beer said, we've had a mental health crisis for a long time in children, and COVID has just put a lot of stress on it. But a lot of the problem is we do not have the resources to attend to it. And the figure that struck in my mind was less than 10% of hospitals in the United States have mental health opportunities. And for children, it's even much less than that. And that's at the very acute level. There's so many stories that everybody knows about. They're trying to find just some mental health support, and you cannot find people who are trained, who are available, because they are totally overwhelmed with the demand. So this is the moment to try to fix that, because
yes, and it's a perfect. I can't resist a commercial for Children's Law Center and the partners, many of whom are on this call, and Dr. Beers at the forefront. We've been working for several years and just put out a path forward, which is a community-wide. It's experts like Dr. Beers, it's family leaders, it's providers who came together to say, how can we reconceptualize it? And right now, Dr. Grady, we are working to advocate with the council to make sure they put enough money in the budget so that we can, among other things, keep all of our school-based behavioral health providers. So
wonderful.
At the very end of this, I will give everybody on the webinar an opportunity to reach out to your council members and support that, because it's absolutely right. It's not a time to nickel and dime our providers. Right. I think folks who are on the front line right now need a little bit of slack, and we need to just give them a little bit of extra so that they can make it through it. It's not the time to hold people's feet to the fire to be the most efficient they can possibly be. I know that has been true.
So bravo to the Children's Law Center. I want to say one more thing, and that is, yes, I don't want to forget that even though mental health is a huge issue, all of the children and adults who have been resilient through all of this, who have been able to come through with strength and grace, and we need to learn from them as well.
That is a very good point. And it makes me ask a question, because I've asked this to Dr. Beers in advance and was fascinated by the answer, which is, I know early in the pandemic, there was a lot of concern among parents. What would it mean for our children to only see people who are masked, especially young children? So I'm curious what we know and what we don't know about the impact of masks on social emotional learning and child development.
Yeah, no, as you might imagine, I get this question a lot too. No, absolutely. And I think, right, so there's a couple pieces to this. And again, whenever you think through these things, you weigh, what do I definitely know? What do I definitely not know? What do we have some evidence for, or what do we have some evidence against? So those are all things that you weigh when you're thinking about this. I think the first thing is that we, going into the pandemic, had good evidence that masks decreased the spread of infectious disease, and that we have increasing evidence of that over the past 2 years, and that particularly in school settings where masks are regularly worn by all the students and staff in the schools, that the rates of spread of COVID are decreased. It's part of a whole package, it's like a part of your whole toolkit of things to decrease the risk, right? And so we don't expect it to be 100%, but it is a good contributor, and it really does decrease the spread. So that's a benefit. But when you think about, so then what are the potential downsides? And so of course it makes sense that we're going to ask that question about development. And so one of the things that we've really looked at and thought about, first is that actually, there are cultures across the world where mask wearing is a really regular thing. And those kids and babies develop well, right? So that's one piece of experience and observation. And we also, know and thought about the fact that, children who are visually impaired actually typically will go on to develop social connections and language and all those things, right? So these are pieces of information for us going into it, which I think are really important. And then I think also just knowing, our brains are smart and pliable, and they respond to all the different cues. They respond to the look in your eyes and the tone of your voice and the way, the cadence of your voice and the playfulness. All of that really contributes to a child's development. And then also recognizing that kids are spending, if you think about the past year, in DC, where there was universal mask requirements in the school, kids were spending a good part of their day around people who were wearing masks, and they were wearing masks, and they were spending a good part of their day at home around people who weren't wearing masks. And so there was this sort of mixture of stimulus. So then all that to say, and then, as time has gone by, we've, seen no evidence that masks do impede development. We've also, on a global scale, we've seen some evidence that it doesn't. There was one study actually that recently came out that actually, this was working with kids who were hearing impaired, but actually for some of them, actually their development was accelerated. And the hypothesis was that people were really focusing on all these other cues and really focusing in on kind of amplifying all these other cues. So, a small study, specific population. And so this, we have to take all these things together in aggregate when you think about this. And I think the last thing to add is that also just recognizing, just like everything, there are individual situations. And so there may be a child for whom, they're having, difficulty with speech development, and the learning team feels like being able to have time to, without, unmasked, and to be able to see the lip movement is helpful for that child, right? And so that's also why it's important for all the rest of us to be doing the things we can do to make that environment as safe as possible for that child, because if that's sort of one protective measure that we want to pull back to make sure that this other piece is really developed, then the rest of us play a role in helping to make sure that child's environment is as safe as possible, so that we can make the modifications that we need to make. So just also recognizing there are going to be individual circumstances, but when you look at it on a global level. Yeah.
We're beginning to get audience questions, but before we do, Dr. Grady, I know you had some really interesting thoughts on one of the other impacts of the pandemic, which is disinformation. So I'd love to talk about that a little.
Yeah, I think it's something that we need to learn more about in terms of impact. But I was looking at some documents. There was a UNICEF document that was put together in 2021. And one of the things they say is that, we have known that disinformation and misinformation is harmful for years. And there is some evidence about the harm. And the harm is, it incites violence, it reduces trust in public institutions, it threatens democracy in certain ways. And during COVID, what we've learned about it is that it also has health impacts. It makes people unsure what to believe about COVID, and sometimes hesitant to do certain things like wear masks or take a vaccine. I think one of the things that I think is really hard for me to figure out, and the reason I wanted to get it on in this call is that I think we don't know yet the full impact of this on children, because part of it is we don't know. Children, adults don't either, but children don't know what to believe. They don't know how to discern what's real information, what's not real information, or what's good evidence-based information from not evidence-based information. And so, this has come, I think, to a head in the last couple of years during COVID. And I think, we know kids, most kids have spend a lot of their time online or on online devices. And so it's just going to get worse. So I guess from the perspective of, we need to understand both the benefits of online access to everything, and the risks of disinformation, especially on the development of children and their critical thinking abilities, and how to think about how to make decisions about what to believe in and what not to believe in, and I think we have a lot to do in this space, is I guess what
Yeah, absolutely. I'm going to turn to an audience question. So I'll read it. What's the best way to support children who have lost a caregiver, had an ill caregiver, or who have been sick themselves as a result of COVID? And what are the best ways to support those families moving forward?
Yeah.
What are some of your thoughts?
Yeah, absolutely. And thank you for that. And Judith, you mentioned this earlier, but it's such an important question. And I think, it's an important reminder that collectively as a nation and as a world, we have gone through quite a bit of trauma. And for some children and families, that trauma is greater. And for many, they've lost more than one caregiver or loved one. And so I think there are a couple of things, this is sort of the advice that I give every family in the midst of a hard and traumatic and stressful situation, which is that the best thing the best way to decrease the impacts of adversity on children is to make sure that they have a safe, supportive, and loving relationship with consistent adult or adults. And so just by being there and being reliable and consistent and loving and offering your love and support, that makes an enormous difference. And we can't underestimate that. I also think it's really important to make sure we talked about mental health and the difficulties of accessing mental health services, but that's where, again, as a community, and Children's Law Center does a great job with this, and we all work together to try to get children and families the supports that they need, but mental health supports, and particularly mental health supports with mental health providers who are trained in grief and loss, because those are specific skills, and it's important to make sure that families are connected. And I think also then making sure, often when families when families lose a caregiver or a loved one, those are also people who were providing material supports to the household, and so that there may be additional material losses of food or housing or financial security that come with that, and making sure that we're thinking about those things and asking about those things and providing the support that we can to help ameliorate those. But thank you.
Yeah, really. It's one of the other things that we're learning about as we go along, is how much loss there's been and how many children have lost parents and caregivers and loved ones. It's very hard.
And I can't resist using this as a moment to say, and if you're trying to help a particular child and need resources, your pediatrician and your school are often good places. We have worked very hard at DC to build the capacity of our health clinics, of our pediatricians' offices, to actually have some behavioral health support in quite a number of ways, and our school-based behavioral health programs. So that is a place to start. And one of our wonderful partner organizations, the One Center for Grief and Loss, is another source for many folks. Yeah. So one or two last questions. I think I've got enough time for one or two. Is can you talk about how to increase the availability of mental health services? Because you talked, Dr. Beers, about the lack. So someone is asking, in particular, how can we work on the workforce, which is my word for what they wrote, is how to increase the number of mental health professionals serving low-income children and families. Yeah. My favorite topic.
Again, I'll do my very best to keep this one, to keep my response brief. And I think one point though, and even sort of following on from the previous point, is it is so important for us to, again, remember that the COVID and the pandemic has really had a disproportionate effect on many communities, communities who are historically under-resourced, communities where families have lower incomes, Black and Brown communities. And so I think we have to make sure, one, that we really target increased resources to those places. I think there's a couple strategies that I would say for increasing mental health health supports. One is really thinking about the continuum of care. It's really important for kids to be able to have access to specialty mental health treatment, but also important for the other people in their sphere, so pediatricians, teachers, community health workers, to be able to provide the maximal support that they're available through their training across the continuum. And that gets at some of our workforce issues, because we can focus on training a workforce who is already there to be better prepared to address the mental health needs, which then can help perhaps relieve some of the strain on our specialty mental health providers to really take care of those kids who have the highest acuity needs. So I do think that's one thing. I think there's lots of financial stuff that you can do to help mental health parity. I know it's on paper, but it doesn't really happen. Better telehealth flexibility, better credentialing flexibility. There's lots of sort of really wonky policy things that we can do to help with that as well. But I do think thinking about that continuum of workforce is really important in 60 seconds.
Yes. And it's good to say that Children's Law Center and Children's Hospital and some of our allies are doing those things, working on what I call the wonky side of healthcare.
Yep, you can read our 200-page path forward report.
or the executive summary, which is what I would say. Well, so we're coming close to the end. So let me end with what was a really thoughtful question that just came in. What types of social and policy supports do you think are already having a positive impact on helping kids and families navigate this pandemic? So what's already been done that you want to sort of uplift as the kinds of things that matter? If you've got thoughts on that.
Dr. Grady, why don't you go first? I've done that.
Yeah.
I did a bunch of talking in the last questions. I don't want to monopolize.
Okay. I guess I feel like I only have anecdotal responses to that question. So for example, I have colleagues and friends who are school principals and school teachers, and they've been doing a lot to try to, meet the needs of the children in their settings. And I think they've been doing admirably well, given the fact that they are also exhausted. It's been a really difficult time, but I am constantly impressed by the kinds of outreach, individual support, programs that they put into place. I mean, everything that they do at the school levels with the goal of helping their children deal with this, what they've been through. Both the lack of school and coming back, but also the mask situation and the loss of family members. I mean, everything, the whole gamut. So I think one thing that I would say is that we don't appreciate our schools well enough in terms of what they offer our children.
I love it.
Yeah, and I think I 100% agree. And I think actually that is such an important point of really making sure that the people and the caregivers and the professionals and who are working most closely with children and families, they just need a little extra right now. They're carrying more, and they need more to be able to do the things that they want to do and they're trained to do and they like to do. I think the other sort of just general statement about services, I think the more services can be integrated into settings where families already are, again, like schools, community centers, pediatricians' offices, the more we can work to integrate systems and get those systems working together, which does require additional resources, because if you're working 12 hours a day doing the work in your setting, you need a little extra to be able to then communicate and work together with the other settings. So those models actually are very effective, and you can apply that sort of concept across any wide variety of programming and intervention.
Yeah, absolutely.
Well, yeah, I have to say, I could talk to you for another hour. I have 100 more questions, and so does our audience, but I promised an hour and we need to keep it to that. So I want to first thank the two of you. You guys are doing amazing work for kids across the country, and we appreciate that. And spending the time with us, I also appreciate. I know that not only do people come and listen to the webinar, but we get a lot of folks going to watch the recording after the fact. So I appreciate it. before we finish today, I want to invite everyone who's on this call to work with us over the coming year. And I'm going to ask my colleagues to put something on screen. I have 3 ways you can help us right now. So if you're a lawyer, we have a lot of pro bono opportunities, including special education cases or housing conditions cases, helping caregivers adopt kids whose parents were lost to COVID, all kinds of opportunities. Obviously, we cannot do this work without funding. We welcome financial donations at any level that you can do. And because we've been talking so much about behavioral health, let me return to what we said earlier, which is the council is currently making decisions about our FY23 budget for the District of Columbia. And we desperately need them to make sure that they put in enough money for school-based behavioral health programs so that our kids can recover. You do not need to be a DC resident. They will listen to you. You can call, you can email, or you can tweet. And just with the message that you believe in the behavioral health needs of our kids, you want additional investments for school-based behavioral health programs. On Twitter, we're #Team SBBH because that's a big community effort. And if you want to do more, feel free to email me at jsandalo@childrenslawcenter.org, and I will get you more information. Again, Dr. Beers, Dr. Grady, thank you so much for the work you're doing and for spending your time with us.
Thank you for having us, and thank the Children's Law Center for all you do. You're really an important organization, so thank you.
Thank you very, very much.
Likewise, thank you so much, and thank you for your partnership, Judith.
Take care, and everybody have a wonderful day.
Thank you.